how do you fix forward head posture? In this video, I'm going to tell you my recipe for just doing that. Here's number one. Number one, you have to remove the restrictions in the spinal joints so the body can achieve a normal posture. We're talking about subluxations. A subluxation is an area in the spine where two bones that come together are actually stuck. They're limited in their range of motion. So either some bones can turn, some bones can go forward, but regardless of that, you have to correct those subluxations because subluxations cause a limited range of motion, and our body is going to compensate for that with that forward head posture. So when you have a lot of restrictions up on top here where the body is restricted in this position and cannot come back, it's literally impossible to fix forward head posture with just exercise. So the first thing that I do is I always correct the subluxations. Most of the subluxations are found in the upper thoracic area right here, which is ironically a difficult area for most chiropractors to adjust. So you need to find a chiropractor that's extremely skilled in that particular area of the spine. It's not easy. The second thing that needs to happen is there are certain areas that in our muscles that become weak or deactivated. So you need to wake these muscles up. There's areas in the muscle where the nerve enters that muscle and controls that muscle, as well as areas where the muscle connects to bone. So there are nerve sensory areas, and what you do is you use a vibration tool like a percussor or an arthrostim to stimulate those areas. The most common areas are the lower scapular stabilizers. And by this I mean the most common that people think about is the lower trapezius as well as the rhomboids. Now I'll tell you, I can have 10 patients in my room that have this problem, and I will ask all of them if they go to the gym, do you do any type of rowing exercises or pull downs or pull ups? And the answer is almost always no. So the thing is, these are exercises that need to be done. So these, if you don't do them, those muscles become weak, they become deactivated. And what happens is in that case, the shoulders round forward. And when the shoulders round forward, the head goes forward. There's your forward head posture. So what we do is we use an arthrostim or a percussor, and we go to these nerve areas of the lower thoracic area, the lower trapezius and the rhomboids and the spinal erectors, and stimulate them. Almost instantly, when you correct the person's subluxations and you activate the muscle, the person literally feels more upright. They can breathe better. They can get more air in their lungs. Their nasal passageway feels better. Their shoulders fall into a more normal position. But the million-dollar question is, how do you keep that going forever? The answer is, you must do exercises. Now, I could give you a list of 5 different exercises to do, but I'm not going to do that. I'm going to give you a combination exercise. It's one exercise that corrects forward head posture, and it's the best exercise that I have seen done. So here I'm going to show it to you. So what you'll need for this exercise is a gym ball. And what you'll do is you'll see me rounding myself over the gym ball to start. My knees are bent, my hands are behind my back. Now how this works is you start extending your spine backwards. You try to look up as much as you can, and at the top of the movement you'll extend your elbows backwards. Also notice my legs are extending, and it's that simple. So I recommend to patients to do 5, 7, maybe 10 repetitions 3 times a week. This is enough to keep those muscles strong, and the adjustments that we do and the neurological muscle treatment that we do, it keeps it going and it helps you with forward head posture. Hey, if you like this video, give me a thumbs up, subscribe to my channel, and I really hope this exercise is going to help you as much as it's helped all the patients that I have given this to. It really makes a tremendous difference.